Welcome, everyone. As Nicholas has mentioned, kindly introduce yourself by typing in the chat box. Introduce yourself in the form of your name, your country, and organization. If you are more than one behind a computer or your connection point, kindly indicate the names of other people who are with you. Thanks. Right. I think it's time. So let me take this opportunity to welcome everyone to our monthly session on waste management. This is probably our 7th session. And today we are going to be looking at, as you have seen from the invitation, the types of incinerators that are out there, how they operate, and issues around sustainability. We know we've been talking so much around waste management, both in general terms and in terms of viral load waste. And one of the solutions that we have actually given along these sessions that we have had is incineration. It's both applicable for viral load waste as well as general medical waste. But we were asking ourselves, what are these incinerators and what is it out there? And we felt this could be one of the sessions that we could actually look at what do we have and probably gain one or two pieces of knowledge in terms of what we have and what we use. Without further ado, I would like to hand over to David Bressler to introduce our speaker and subject matter expert today.
Thanks.
Meanwhile, Dave, hey, maybe you could share your slides.
Thanks a lot, Anafi, and good afternoon, everybody. As Anafi said, I don't think I could say it any better. We've had now, I think, 7 sessions in the waste management LabCoP, and as Anafi said, we have gone through the introductions, the issues and concerns about general hospital waste management, and we are trying to narrow the focus to viral load waste management. And as we've gone on, we've discussed various issues with viral load waste and how to handle it, some of the concerns, and that sort of thing. And so what we wanted to do, as Anafi said, is give some of the mitigation strategies that are potentially for use for viral load waste. And one of those would be incineration and incinerators. And so being that there may be a lack of knowledge regarding the specifics of incinerators in use in different countries, what the characteristics should be for handling medical waste along with viral load waste, we wanted to bring on an expert that had some background, or actually in this case, probably a lot of background on the incinerator process, the characteristics of incinerators and that sort of thing. And so let me introduce Dave Ausdemore, and I'm going to sort of go over what his background is, and I'll cover the bullet points for the topics that he will cover today, and then I'm going to turn it over to him. So let me just introduce him here. Dave Ausdemore is physical engineer as well as a CIH, a certified industrial hygienist, and he is the founder and president of Health System Sciences, LLC, that specializes in global health, environment, safety, and emergency response services. His experience and expertise is developed from 25 plus years, developing and managing technical programs with the U.S. and international governments, United Nations agencies, and the private sector in the U.S., Africa, Asia, Middle East, and Latin America. Mr. Ausdemore is a former CDC employee who launched various environmental initiatives, including sustainable waste management, and biosafety for international PEPFAR programs. And I just want to touch on that last statement. What we're trying to do with the waste management issue is actually deal with the viral load waste in that it contains guanidinium isothiocyanate. It is, as we know, a large component of the viral load platforms and the waste products that come from it. So finding solutions to deal with that that are both cost effective and sustainable is important. And so that's one of the reasons that we wanted to have Dave speak to us. So as part of the topics that he will be covering today regarding incinerators, he will review the types of incinerators, the operating parameters for efficient destruction of waste, and the sustainability considerations. So with that, I believe I will turn it over to Dave. And Dave, you can take it from here.
Thank you, Dave. Dave, we have two Daves today. So Dave A, please take over. Thank you. Dave, if you are speaking, you are probably on mute. Kindly unmute. We can see your screen now, but we can't hear you.
And just like you, okay.
Oh, wonderful.
Like you said, I had mute on, so you can hear me now, correct?
Yes, we can hear you clearly.
Yeah, we can get you.
Okay, great. So first of all, let me say it's certainly an honor and privilege to be able to present to everyone this morning. Dave Bressler provided a brief background, and yes, I used to work at CDC. I retired as a public health officer about 5 years ago. Actually, it was January 1st of 2014. And when I was at CDC, one of the initiatives that I spearheaded was looking at sustainable waste initiatives dealing with the PEPFAR waste. So I had a chance to visit a lot of locations, to do assessments and to come up with just ways of helping to improve the way that waste was disposed. And I have to tell you, working at CDC was probably my second best job I've had in my life. It was a great job, a great opportunity, and my first best job would be what I'm doing now. So now I'm retired from CDC, but I'm not retired. I have my own company. I do my own projects and have a lot of interesting work and challenges that I take on. I've been doing some work with the United Nations Development Program, looking at different some waste management. I had one project last year that dealt with sustainable procurement in the health sector, which dealt with 11 countries and going from cradle to grave. Some other environmental initiatives with the UN. And then from the waste perspective, I've supported some other sustainable waste initiatives in Africa, which I'll talk about here towards the end of my slides. So as we go into the materials, I injected another topic, and that's the why and the what. So before we get into the meat of the conversation, I think it's prudent to set the stage, to talk about the different factors. And the reason is because, the type of technology, and in this case, it's incineration, is only one small piece of the puzzle. And based upon the discussions in the introduction, it sounds like your group has been addressing the other pieces. But as a refresher, I'll just touch on some of those. So first of all, the question is why? Why are we managing medical waste? Well, there's the viral load initiative that's taking place, and simply you have to take care of it. But as public health professionals, there's several other reasons. I mean, first of all, it's not just to get rid of the waste, but it's to protect human health and the environment. It's to prevent mishaps in the laboratory that's going to cause that can result in cost. It's required in many countries. And you know, there's a security and quality, but I'd like to jump to slide number 6, which is, you know, as public health people, it's, you know, we're here to do no harm. And sometimes that happens when I've had the chance to visit a lot of hospitals, and that includes all over the world here in the U.S., is there's a considerable number of hazards that go out our back door. Go out our chimney stacks and into the wastewater that do provide a lot of unique hazards that harm the public. So it's a global initiative that we're trying to reduce or eliminate those type of hazards. So back in 2003, when I was dealing with PEPFAR waste, there was this surge of these unique waste streams. You know, in addition to the viral load, and back then viral load was at 2.5 million, and I'm sure it is quite a bit more than that right now. But that's one type of unique waste streams that resulted from the PEPFAR initiative. You can see numbers for counseling and testing, from care and support, for male circumcision, and the blood supply also was doubled. So with these new unique waste streams, it posed additional demands upon our waste disposal infrastructure. And of course, you know, when we talk about medical waste, we're talking about quite a few different types of waste. I mean, there's your traditional waste, which would be your red bag or your sharp box waste, but as you're all probably aware, is that there's these different unique categories of waste that need to be addressed. And with the viral load that I heard Dave mention isocyanate, so there's a unique characteristic with that needs to be addressed. And you know, it's a matter of really scrutinizing each type of waste category and having that as a different waste stream. And of course, with the waste management, that there's several different steps here. So you can see in that second to the box from the bottom, you know, that's the one dealing with the treatment technology, with incineration. And the incineration is only one small part of it. So it's each of these steps that need to be properly managed to make sure that once you get to the incineration process, is that your waste is properly segregated, that it's minimized, that you have the quantity of waste, which would be a smaller quantity of waste that actually needs to be treated. So it's very important to make sure that each one of these steps are in place. Now, working at CDC and dealing with the waste initiative, you know, it came down to these 5 different waste management elements, and these are the programmatic elements that are probably very common with any type of the health system strengthening activities. And you know, there's the 5 steps of waste management, but there's these elements to deal with. And once again, it's very important to ensure that each of these elements are properly addressed. And you know, one of the shortfalls that I've seen in a lot of different places is that the treatment technology, which is usually the incinerator, will be addressed, will be procured, and you know, initially the incinerator will work well, but then there'll be gaps that will be addressed. You know, there might be the personnel might not be trained properly, the equipment might need to be maintained, or certain components will break down. And without these different elements in place, you know, it's just it results with a treatment process that's truly not sustainable. That's going to be short-lived and result with a broken system. So as we see with waste management, that there's a lot of challenges, and these are challenges that I created this list from the different countries. These are pictures that I've taken in different countries, and you know, so when we're dealing with incinerators, it's that first bullet, which is talking about the resources and the infrastructure. make sure those infrastructure technologies are in place. But you know, there's been a lot of success stories that have been identified out there as well, and there's a lot of opportunities that are at our fingertips that can be established. So it's a matter of taking those best practices, identifying those, and to share them and promote them in other areas. So as we talk about incineration, you know, one of the challenges that was in the previous slide was talking about inconsistent design specs, and you know, the point is when we talk about incinerators, there's a large variety of incinerators out there, and what's also interesting is when you start talking with incinerators about incinerators with a different group of people or people who are from different regions, those incinerators, the incinerator equipment are different. They're different types of equipment, that they're different shapes, they're different sizes, they have different operational parameters, and you know, it's important that we talk about the same type of technology when we're talking about incinerators. But even with the different types of technologies, the concepts are the same. And I'll talk about the operational concepts here in a moment. But you know, what we see there in the upper left-hand corner is probably one of the more common incinerators I've seen that exists throughout Africa. And this is the brick-constructed de Montfort incinerator, which technically is considered a dual chamber incinerator. And it's that dual chamber incinerator which is important, which is the ones that we're going to really focus upon. And then we see these hybrids. So in the right hand side, I'm not sure quite what that is, but this is another type of incinerator that's out there, which is challenging, and it has to be operated properly. And you know, I think it's a matter of following the concepts that it can happen. So with the dual chamber incinerator, this is one example of a commercial dual chamber incinerator that's out there. And you know, these dual chamber incinerators, they come in different sizes and different styles. And as we go to the next slide, you'll see what the concept is. Now initially with incinerators, and it's still true today, is that there was a big push for them to primarily address the Stockholm Convention. So this was advocated by the United Nations Development Program and others, which was to eliminate or greatly reduce the dioxins and the furans types of combustion byproducts that would be released from the chimney stack. And even though it was dioxins and furans for these specific types of contaminants, that's not the only reason to have an incinerator operating properly. So what you see here is, as the waste goes in, and this includes, you know, infectious waste, it includes some chemical waste and others, but there's two different types of chambers that the waste is processed. There's a primary chamber that does the main destruction of the solid waste, and then there's a secondary chamber which will help further break down the chemicals that are in the exhaust. So this is the concept that we need to take in mind. And when we look at the primary chamber, you know, in order to get those temperatures at the range to allow that complete destruction, there's a couple of different components that need to be addressed. I mean, what some of these things we see are supplementary flames, and these flames will be powered by secondary by other air sources with fans. So as I go into the next slide, we're going to look at the different components. So, you know, this is probably this slide here is probably one of the key concepts that I think is important. and to understand this, to understand, you know, with the two chambers, to understand that it's important to get those temperatures high, and so forth. So I understand we're going to have time for questions afterwards. So if there's any questions about this, we can please raise it. So as we look at the different parts of the incinerator, in order to achieve, you know, those type of conditions we want, primary and secondary chamber, there's all these different parts of the equipment that are needed, right? And you know, each component, it needs to be maintained. It serves a purpose, even from the door with the gasket to keep it airtight, to having those fans to be operational, and to be able to essentially have the proper temperatures maintained throughout the incineration. Yes. So it all comes down to this, and these are these best practices that have been identified for complete combustion. And what it comes down to is making sure that you have the proper temperatures. So even when we look back at the different varieties or the different designs of incinerators, if we don't have a dual chamber incinerator, and there might be some of these single chamber variations that might exist at your facility, it's important to have those high temperatures. And that's really the crux of the message here, is to ensure that the temperatures are at a high enough level that's ensuring the complete destruction. To have the high enough temperatures at the primary chamber, and if you only have a primary chamber incinerator, it's still to get the temperatures up there. And you know, I think another key bullet here is to make sure that you have that temperature at high enough before waste is starting to be introduced. So it's important to prime it, to have your auxiliary burners, to have your fans in place, to have the temperatures high enough so as you introduce your waste that you're adding to it. Now my understanding with the viral load waste is that it probably consists of mainly plastic and some liquid waste, and that plastic can serve as a heat source as well, so it burns well and allow you to get temperatures up there. So when the temperatures are elevated at the right point, those auxiliary burners or whatever other auxiliary heat sources you might have can be shut down once your waste starts burning, right? So if you have a high sourced plastic waste, there's no reason to have that. And also, you know, since there's different incinerators out there, different designs, and if you don't have the automated dual chamber incinerators, it's important to have your process established for those different type of incinerators you have. I think another key ingredient to have full combustion here is to have good airflow. And even with the De Montfort, the brick constructed incinerator, you know, it's a dual chamber incinerator, but there are not any auxiliary fans. And because once the incinerator is stoked up, that there's a natural airflow that's taking place that allows the type of full combustion to take place. So these are the key components. So really, when it comes down to incineration, you know, we saw the variety of the designs, we saw the type of components, and we see these type of procedural components that need to be implemented for that full combustion. And you know what, I'm looking forward to discussions and questions afterwards. But as we go from incineration, I guess it's important to realize that incineration is probably the immediate solution to the challenge at hand, but it's probably not the permanent solution. And you know, different type of solutions that or emerging issues that are out there is I've seen more PPPs, the public-private partnership opportunities, taking care of waste. I mentioned last year I did a sustainable procurement for the health sector project with the United Nations, and that's addressing the cradle to grave components, and which includes the type of material and packaging, and to minimize those type of things. And then I've seen other discussions, I don't know if I've seen this fully implemented, about reverse logistics. So instead of addressing the destruction of the waste at some of these sites, which might be remote or might be without the type of treatment technology, it's a matter of getting that waste product to an area where they can properly deal with it. So other initiatives that I've seen for advancing beyond at the site incineration, it includes these type of bullets. I think probably, when we talk about viral load, I know that there's a toolkit going out there. I'm not sure what other activities have been taking place. I think having a pilot project would be a fantastic opportunity to have the different types of locations to show how waste the viral load waste can be addressed. And I think another solution here is advocating this non-burn technology and recycling that's starting to materialize in some of the locations. When I was leaving CDC, we saw the supply chain management system with a commodity review is to really focus on the type of items that were available, to include waste treatment equipment, to make sure that the proper incinerators were available. Now, when I'm talking about supply chain management system, this comes in a couple of different forms. PEPFAR had a main supply chain management system that was supported, but supply chain management systems also pertain to the countries. So each country has their own supply chain management system from usually from their Ministry of Health. And one area to address is what's available there, and specifically to make sure that a proper incinerator is included there, to ensure that at that procurement level that that a review is conducted to ensure that this is the best type of technology available to the country, so that review doesn't have to be done every time a facility is going to procure an incinerator. And then along those notes, I mentioned that there's several different components for a dual chambered incinerator. For example, there's the auxiliary fans, there's the burners, and these parts wear out. So if there is specific equipment identified in an organization's supply chain management system, then those spare parts should be incorporated as well. So incineration, I mentioned it's probably the best thing to use, the best technology to use for the current demand. However, incineration has a lot of problems associated with it. I don't want to discount what I mentioned there in the last bullet, is that incineration is a very good option if it's properly used. However, it's being recognized in other parts of the world that it's not the ideal technology in many places. One study I want to mention is there's this cancer cluster study done for some of the combustion byproducts of incinerators. And what they realized was, what they stumbled across was there was this tribe in Alaska. And if you're familiar with Alaska, it's way up north. It's up there by the northern part of Canada. So it's a very isolated location. And they identified, so somewhere along the line, they identified there was a cancer cluster up there with one of the tribes. And the cancer cluster, after much investigation, they identified that the population was exposed to dioxins and furans. And then what they discovered is that up there in pristine Alaska is that they were in the wind patterns of the exhaust that was generated from the burning that was conducted in the industrial world of the US. So here you saw these type of pollutants that were carried away from the source of generation and being deposited in other parts. And then when I think of locations, I think of Africa as being a prime suspect of this when incinerators are used. But this can be avoided with the right temperatures, with the right maintenance, but it's something to keep in mind as a precaution. And when we talk about incinerators and the other parts of the world, it's an interesting history there, is that back in the late 80s, is that incinerators were thought to have been the solution in many countries. And what, using the US, and I think I have a slide there for the US. I do, it's right there, it's the first one. It was in the 80s that infectious waste was identified as a problem for us. And there was this quick ramp up of having incinerators at every hospital. And what they quickly realized is that these incinerators weren't being used properly, that improper waste was being disposed in them. And they quickly realized that on the spot, on-site incineration wasn't the best type of solution. So you can see what happens is that back in 1988 that there was 6,200 medical waste incinerators, and now that there's down to I think the number is actually closer to 35 for the number of medical waste incinerators that are operated in the US. Now I'm familiar with the operational side too, because when I worked at the CDC, one of my jobs before I started supporting PEPFAR was to manage our internal environmental programs. So part of that was managing our medical waste incinerators that we had on site at the Atlanta facility. So just to allow awareness here, it seems like one of the solutions for non-burn technology is autoclaves, and autoclaves also exist in different shapes and sizes. That there's the smaller ones that are, well, actually all three of these are used for medical waste. I think that first one is used in Nepal, but this is common in the US as well, where you can have these large industrial ones. And the thing I like to mention about non-burn technology is I've supported some projects installing the autoclaves and shredders in some of the African countries. It's advanced technology that needs support, and there's challenges associated with it, but it's a good consideration for the path forward. And autoclave isn't the only process for treating medical waste. Once waste is autoclaved, it should be shredded. And there's different types of shredders out there. The solution that we identified is that first picture, which is a high torque, low speed shredder. And really it gets that waste where it's safe to handle, it's unrecognizable, and once it's treated, it can be disposed. Well, it's also reduces the volume tremendously. So we see the volume being reduced from 70 to 80%, and it can be disposed in landfills. So I think I threw a lot of information from you, some critical information about incinerators, key points to keep in mind as you are trying to operate your local incinerators. And I think this would be a great time to pause and to take any questions.
Thanks a lot, Dave, for the very insightful presentation. We all agree, I think this is a very important subject, and as a group, we have identified incineration as one of the solutions that we have out there. And we felt, as we had mentioned earlier on, it's important that we know what does this really entail. Incinerators, you mentioned in terms of infrastructure, these do not come cheap. And it's important that we also understand what exactly are they, and so that we make the right procurements. We have a lot of questions, I think, that I saw coming into the chat box. I'll allow Nicholas to take us through the questions, and you kindly respond.
Yep.
Nicholas, over to you.
Thank you very much, Anafi, and thanks, Dave, for the wonderful presentation. There are a couple of questions in the chat, and I'll read one by one, and then you respond. And the first one is from Arosias, and he is asking, can most countries afford the cost of maintaining incinerators? Can most countries afford the cost of maintaining incinerators?
So I think the short answer is yes, and that's where it's important to look at those different components. Yes, situations vary country by country. Some countries are in a better position to immediately address that, to install, as to have a waste management system. And I think where the biggest challenges come is what does that waste management system look like? Does it look like where you have waste treatment technology installed at key facilities, and that you have a transportation network that's in place? Does it look like you have what level of technology? And what I've seen is where technology, or where resources are more limited, there is that good old de Montfort incinerator that is a great alternative. And the reason I say that is it's a low-cost brick constructed incinerator that does have a short lifespan. However, it serves a great purpose, and it reduces the waste tremendously. And when we talk about cost, I'm not that familiar with what's been happening in the last few years with the viral load, but it should be part of it should be part of the cradle to grave approach. So when when supplies are being procured for different initiatives, so if we're talking about viral load, there should be a line item, for disposal. And I think what would be prudent is for the countries to identify, along with the donors, is how is this going to be disposed, and what's necessary for it? What's the existing infrastructure that's in place that could address it, and what are the gaps or where it needs to be strengthened? That's a long, wordy answer. That I realize that some countries have more limited resources, but I think this is something that has to be truly addressed with the donors.
Okay, thank you very much. The other question is from Nola Vere, and she's saying, hi Dave, thank you very much for the informative presentation. You mentioned that there is need to minimize waste before incineration. How do you minimize liquid bioload waste? Is there a practical way, stock solution, solidify liquid waste before incineration? Once again, you mentioned that there is need to minimize waste before incineration. How do you minimize liquid bioload waste? Is there a practical way or solution to solidify liquid waste before incineration?
So I'm not that familiar with the viral load waste. However, when it what I imagine is, when we talk about a liquid waste, what are the properties? Is it an infectious waste there, or are there specific chemicals there? And if there are specific chemicals of concern, then the question is how to treat those type of chemical waste. And Another job I did at CDC, another type of expertise that I have is dealing with chemical waste. So you can imagine at CDC, where we had over 600 laboratories, we had probably thousands and thousands of waste streams. And it's a matter of really characterizing the waste stream. So I don't have an answer for how do you treat, what do you do with the liquid waste, but I think you're on the right track. Is that, and I understand that there's a study out there that's been done to characterize it. So the question is, based upon the study and part of that toolkit, is what are the properties identified? And what I would do is the process I would follow would be, and I think you're on the right track here, is to separate those two, is to separate the solid casing housing from the liquid waste, and then to figure out what's the best way to minimize it. And the one thing I would not do is I would not solidify the liquid waste unless it had very harmful characteristics. So I think you're on the right track. It's a matter of separating those two, and then to find the proper disposal route for each of those.
Okay, thank you very much. I don't know whether the other colleagues, Dr. Charles, Anafi, Dr. Pasco, and then David Bressa would want to add on to this. Yes?
Yeah, Nicholas, thanks a lot. I think it's a very important question that Nora has raised. And whilst one of the solutions that we have that has just been done on a pilot scale is charcoal, I think we currently don't have, I think, a formally sort of method to really extract that liquid and solidify it. But I know our colleagues from CDC, maybe Monte, can speak to this. And there's some work which is being done in the background to see, I think it's still under research, to see if that could be a solution. Monte.
Hey, Anafi, this is Dave.
Hi, Dave, yeah.
If Monte's not on, I'll just kind of take a stab at the question Nora had. Yes, we are trying to deal with that issue of the liquid and trying to figure out how best, if we consider incineration to be one of the ways to mitigate, do final mitigation of the chemical, basically what is chemical waste from the viral load. We are looking at solidifying, and as I mentioned earlier, we're looking for a sustainable way to do that. And one of the things that I think some of you had heard during one of our previous LabCoP sessions was the Mozambique experience that we heard from Luca Fontana, who's based at MSF. And they were faced with the same issue of what do they do? They were trying to store all of the liquid volume from all of these runs from their viral load platforms, and they ended up storing for, I think it was something like 4 years worth of waste, and they didn't know what to do with it. And so they came up with a very resourceful way to deal with that, and that was utilizing readily, locally available charcoal that was produced, through the countryside. And Luca devised this strategy for pulverizing the charcoal and grinding it up and making sure it was a fine powder, excuse me, to be able to absorb the liquid waste more readily. And so we've had Luca on, and what we're trying to do is explore that solution or that strategy to see how we can further refine it and make it a reasonable and sustainable option for the folks that have to deal with this, maybe on a larger scale. And so, yes, Nora, we're trying to work out the characteristics of that plan. We are trying to figure out the specific qualities of the charcoal, where to locate the grinding infrastructure to make more quantity of charcoal and that sort of thing. And so there is some research going on in the background here at CDC that we're trying to do to figure out a better way for Africa and to use this as a solution. I'll leave it at that.
Okay, thank you very much. Let's continue with the questions. The other one is from Irari Kapoteza from Malawi, and he is asking, at what temperatures do the incinerators operate? At what temperatures do the incinerators operate? Yes, Dave.
Okay, you know what, I have a chart for that, and there is a typical temperature for those autoclaves, and this is one number I don't have memorized, but I mean, there's a number there, right? And with autoclaves, I mean, they all have settings, and you know, what it comes down to is there's a temperature versus time. So there's this kill temperature that's out there. So you know, it depends upon, well, it doesn't depend on your autoclave. Is that, man, you're throwing me a curveball here. So there is a temperature. I don't know what that specific temperature is, but it's the common temperature that all autoclaves are usually operated at. So when we talk about waste, it's not doesn't require a different temperature than what would normally be used for an autoclave that's probably used in a laboratory.
Okay, thank you very much. The other question is from Manafi, and he is saying, incinerators do not come cheaply, so making the right procurement is very critical. What guidance document do you recommend that can be assessed by country teams to make decision-making easier? Once again, what guidance document do you recommend that can be accessed by country teams to make decision-making easier?
I think a starting point would be looking at the one slide I shared about the operational performance. You know, maybe specifying that. I think that this would be maybe something that could be addressed in a toolkit, is to have the specs identified for procurements. I mean, that's the short answer to allow something to create a document that provides the type of detail that would be useful in the field level to do those type of procurements.
Okay, thank you very much. The other question is from Dr. Pasco, and she's asking, who are the most obvious private partners to engage? Who are the most obvious private partners to engage?
It depends on your situation or on your region. You know, when I showed the slide with the opportunities, you know, when I was doing my assessments and my country visits, I was surprised how some countries would actually have companies, actually had some companies exist who provide medical waste or medical or hazardous waste disposal services. You know, so I mean, if you're in that type of environment, that's certainly a solution. If you're in a different environment that doesn't have that, you know, I would first go to your larger facilities. I would go to your larger hospitals and see what they do to deal with their waste. Blood centers might be another thing to consider, and to see if partnerships could be developed where they could support your type of waste. I realize that there's different situations and then that it's all over the spectrum. So I think my answer for this is it depends. It depends on your country, it depends on your situation. If there isn't any type of waste disposal systems in place, you know, the question I would first pose would be to the ministry level to see what their plans are. What I have noticed is that most Ministry of Healths have some sort of plans on dealing with medical waste. So then the question would be, well, how can your viral load waste streams fit into the national plan?
Okay.
Thank you for that answer. That's Pascal. I just want to continue a little bit on that. So it was nice to see that you recommend to have public-private partnership. But it looks like the waste management, I mean, although it's medical waste, it's not only a matter of the Ministry of Health, wouldn't the Ministry of Environment, also be like a partner, because waste is a lot larger than just the lab and even just the viral load. So what would be your recommendation? If at the national level you need to establish a technical working group that will think about establishing a waste management system that's incorporate incinerators. I don't think that the viral load lab does that on its own.
Right. So it sounds like you might have answered your own question, right? Is there should be a technical working group. It should include representatives from different fields, and I think it's best just to start those conversations, to start asking those questions. And I would be surprised if those type of discussions or working groups haven't already been established.
Right.
And if they haven't been established, it's a great opportunity to kick things off and to maybe to initiate things from your organization.
Okay, thank you very much. The other question is from Dr. Charles Chiaga, and he is asking, he is saying, it is not very clear how the waste containing a high proportion of plastic material should be handled. Can you please make it a bit more clearer? Plastic may never burn into ash. How do you handle the byproducts of combustion? Once again, it is not very clear how waste containing a high proportion of plastic materials should be handled. Can you please make it a bit clearer? Plastic may never burn into ash. How do you handle the byproducts of its combustion?
Yep. So I think plastic is the best type of waste product you can have to incinerate. Plastic usually contains high energy that provides a great fuel. And in fact, when we look at medical waste, it's usually the plastic syringes that are segregated and, well, not segregated, well, they can be segregated, but that are considered to be almost a commodity because of the high caloric energy potential that they use. And when we're talking about the liquid waste, one thing that went through my mind was it depends on the proportion of liquid waste. And once again, I'm not that familiar with the viral load waste, if it's cartridges or what, but if it is a combination of liquid waste and a plastic cartridge, it seems to me that the plastic cartridge would serve as a great fuel to help destroy the liquid waste. So it could be a very good combination. So when you mention that plastic does not burn completely to ash, the question that comes to mind is well, how efficient are your parameters with your current burning device? If you notice in the slide where it spoke about best practices for combustion, and it was talking about the dioxins and the furans, my guess is that you probably don't have the right temperatures that you're introducing the waste to. So once you have high temperatures, and we're talking about 850 degrees Celsius or higher, is once you start introducing your plastic cartridges, that it will continue that burn and it will take care of the high level of moisture as well. So yes, plastic is probably the best type of waste that you can incinerate, and that you should absolutely expect a full combustion where it burns into ash. In fact, you should probably see very little ash that results from burning plastic, because plastic is a type of a petroleum product.
Okay, thank you very much. The other question is from Collins Odiambo, and he is asking, is there a global move towards non-burn technology due to the hazards with incineration? Once again, is there a global move towards non-burn technology due to the hazards with incineration?
So the short answer is yes. And there's been different initiatives out there for using non-burn technology. And there's been a lot of introductions, and it's a newer technology that needs to be built upon and to continue. Last year I mentioned I did a baseline assessment for 11 countries with the UNDP for sustainable procurement in the health sector. And the reason I say that is another component of that project was to install non-burn technology at some of those countries. So I can tell you is that right now that the UNDP has a team. Actually, it's UNDP in collaboration with Healthcare Without Harm, and they are installing autoclaves with shredders in a couple of African countries, and I believe those countries include Ghana, and I think it includes Zambia, and maybe Tanzania. It is Tanzania. I've been to the one in Tanzania. Now I'm always cautious, or I'm a technical person. I'm a professional engineer. I'm an industrial hygienist, and I've seen a lot of systems. And the thing is when I see these systems installed, that there's opportunities for improvement. So I'm always cautious that. I'm always a bit concerned that when new technologies are introduced and they don't work properly, then they're discarded and considered a failure instead of building upon them. Now, I've personally have assisted with installation of non-burn technology at a few locations in Kenya, so there is a movement, and what we see with the United Nations Development Program is now it's about sustainability, and non-burn technology or proper disposal and reducing pollution is a key component of sustainability.
Okay, thank you very much.
Looks like, Charles, Nicholas, thanks. Looks like I think time is a limitation as well. We still have a couple of questions that are in the chat box. As usual, we will try to compile these and follow up with Dave to get the responses to them. Dave, we usually have a WhatsApp group associated with these sessions where there is a 24/7 interaction on these issues. So we'll kindly get back to you with those questions that are pending, and I'll also ask for your responses that we can share with the group. We may also request, if you are interested, to join the WhatsApp group either permanently or for this session, to try and respond to any other questions that may be coming through. We have only a few minutes to go, and as usual, I think I would like to thank Dave, and also have some announcements to be made. Charles, are you there? Do you have any announcements? Charles, if you are speaking, you're on mute.
Yeah, thanks very much, Dave, and the rest of the team. It has been a very informative session, and there's been a lot of interest. You could see that from there's so many questions that still remain unanswered. And as Anafi has said, let us exploit those other channels to have our questions answered. Yeah, just our usual LabCoP Eco session will be announced in the next few days, and you'll be informed on the dates and the details. Just keep your ears on the wall. And then we have a face-to-face meeting that is happening next month, October 22nd to the 24th. And we have already sent in invitations for countries to select attendees. And whichever country team that has not yet finalized the list of attendees, please do that very urgently. Before end of this week, we need all the lists to work out their logistics. And then you remember there has been a viral load assessment that has been ongoing. Most countries have returned their assessment forms, and if there is any team that has not yet returned the assessment form, please do before end of this week. That will be very, very helpful. And then there's a demand creation hashtag campaign, demand creation campaign hashtag that we have circulated to the country teams. Country teams are supposed to design a demand creation, a catchy hashtag and phrase that to be used for demand creation. And this is going to be, they are going to be assessed during our face-to-face meeting, and a winning hashtag will will be selected during the face-to-face meeting, and will be our hashtag that we are going to use in our subsequent demand creation awareness campaigns that will run through our next phase of viral load work. So please work on the hashtag country team leads. Please lead your country teams to come up with the most catchy, most compelling, and most competitive hashtag that will win the day during the face-to-face meeting. Otherwise, thank you very much. And I hand back to Anafi, I think, to close.
Thanks a lot, Charles, for the announcement. And thanks a lot for you, I mean, everyone who came through and for the engaging discussions. And I think as evidenced by the questions in there, I think this is a very important subject that we need to keep on looking ahead. And it was also clear that I think we still need more guidance around this. And that, I say thank you and goodbye. See you next time. Bye.
Bye.
Right.